I'm Dr. Barbie Sullivan, and I'm one of the partners with the Women's Clinic in OBGYN. I worry about these last couple of years and women, postponing their appointments. I mean, we were closed for a time and did not do gynecologic appointments. And so then we started seeing people back, but trying to see our younger, healthier patients and that kind of thing, telling the older patients they still probably needed to quarantine. And so now that we have a system and our office is very safe, and, we are cognizant that people are coming in here that could potentially be exposed to COVID. And so we try to do everything that we can to protect our patients. But I feel like there are patients out there who have put off having their mammogram, may put it off 2 years or 3 years, and that's just too long. If you catch it early, if you have the right kind of mammogram and great radiologists looking at this, and, I could not ask for one piece of my treatment or one piece of this to have been any different. Like, wish I had somebody else who read my mammogram, or do I wish No. I mean, I got exactly the care that my patients get when they come in here, and I was thrilled with it. And I think if you've put off having your mammogram because of COVID, please come in and let us know that, because we can help you feel safer. But please come in and have your mammogram done, because it is important and it does save lives. This is an area that we really are learning a lot about. And over the last few years, the volume of mammograms that have been done in the country, the radiologists have noticed, initially we would say we have dense breast tissue that may cover up a breast cancer underneath it. But now we know that it actually may, by itself, increase your risk for breast cancer. And it's interesting because Dr. Reich, who did a wonderful video on this for us, and it's on our website, Dr. Reich was giving us a talk the week that I was diagnosed. And she put a picture up there of these just extremely dense breasts on mammogram. And my gynecologist looks over at me if she's in the same meeting, and she goes, "Those are your breasts." And that really, truly is my only risk factor. I don't have a strong family history. I don't have other risk factors. I'm pretty healthy. I eat well. I'm not overweight. And so that really was my risk factor, was having dense breast tissue. And we're learning more about how we should follow that up, how we should follow patients who have dense breast. And we are staying right on top of that, because we know the importance of density in breast tissue and that link with the potential, with that being a risk factor for breast cancer. I'm Dr. Barbie Sullivan with the Women's Clinic. If you come in and have your mammogram done and it's determined that you have dense breast tissue, you'll get a letter in the mail from the Women's Clinic that says that you have dense breast tissue, and that's something that we are watching, and it may be a conversation that you really want to have with your physician on your next visit. We want you to understand that we are aware of that and we are following that. In some patients, we are doing some different scans, like possibly an MRI or that kind of thing, but it doesn't apply to every patient. A lot of patients have dense breast tissue, but you do want to discuss it with your physician when you come in. So if you get the letter that says that you have dense breast tissue, we have very good information on our website that you can look up about dense breast tissue. And then we really encourage you to have the conversation with your physician next time you come in to see if you're someone who may need some kind of heightened screening. And I believe in the next few years we'll probably have some new way to screen people for breast tissue. The Women's Clinic has always been on the forefront of, we were the first to get the 3D mammogram in town, and if there's some new technology out there, we will strongly push for having that in our clinic also.